Good morning. Sorry about the technical difficulties we've been having. We will start again. I'm Victor Ronis-Tobin, Director of the Center for Population Health. Thanks for being here. We have a great panel. We're going to discuss employers dealing with rising cost of healthcare. Let's introduce the panel. We're a little bit behind. So here to the left of me is Peggy Barker, Vice President of Human Resources for Maxine Cranes. Next to her is Kate Reed, Chief HR Officer for American Modern. We have Rob Dunham, Director of Corporate Health at TriHealth. Dr. Terry Lehman, Medical Director of Marathon Health. To my right, Susie Dick, HR Manager for Shepherd's Chemical Company. Jack Cameron, Administrator for Delite Township. And last but not least, Matt Mikolajewski, Senior Benefits Specialist for Advix North America. Thanks, guys, for being here. Appreciate it. Before we start, the way we're going to do it, I'm going to ask you a few questions. We're going to talk to the employers first, and we're going to talk about solutions from the solutions providers in the room, and then we're going to open up the discussion to the public. Please use the chat to submit your questions, and we're going to monitor the chat and engage in answers. First, we are all aware of the rising costs of healthcare. It's an annual ritual. Xavier just went through open enrollment. We all accept rising costs every year. However, the employers have been bearing the brunt of it. And if you can see the slides behind me, you can see that the cost of care has been rising consistently over the last decade to a place where it may really hurt some employers. We also know that high deductible plans have been on the rise as a solution for some people. So please tell us a little bit about your company, about your struggles, and some of your solutions. How did you address it? How do you address it? And maybe we'll have a conversation later about how this partnership between providers and employers can help. Thank you. Peggy, why don't you start?
Okay. My name is Peggy Barker. I am the Vice President for Human Resources for Maxim Crane Works, located in Wilder, Kentucky as headquarters, but we have 62 branches throughout the U.S. I have 3,000 employees that report to the company, although only about 600-700 of them are on our health care. The remaining balance are union employees, and we just pay for their union benefits. So we don't have a lot of control over that. That is our highest cost health care that we have. We pay over $100 million in fringe benefits per year. Can't do much about that. Those are local contracts that are negotiated where they are, and we're stuck with the benefits as they present themselves. For the remaining portion of our workforce, they're, like I said, range between 6 and 750, depending on the season. We have primarily, we're self-funded, currently through United Healthcare. We have stop loss coverage through Voya. And one of the things we've done to decrease costs is to increase our stop loss amount, our deductible. So when I came on board in 2017, we had a stop loss deductible of $150,000. We weren't seeing people get to that point, or maybe one or two. So we gradually lifted it over the years, and currently is at $250. We still have not had, this year I think we've had one that's going to hit it. So that so far seems to have been a good call. You never know one year when you're going to get, all the people necessary to hit stop loss and make it not worth the savings that you got. One of the other things that we've done is look at our wellness program. As I was explaining earlier, our wellness program prior to my taking over was a company that came into all 60 branches, took a blood sample from every person and their spouse, and sent them back a report. We switched over to WellWorks for You, and it's a very interactive, physician-focused and patient-focused program that really requires the patient to do 3 things in order to get the differential on the premium. First is going to their physician, getting certain test results. So we know there's engagement and interaction with the physician rather than just some numbers that somebody gave you in an email. Number 2 is the typical stop smoking program. And then number 3 is, we like to say it's kind of fun. It's getting 20 points from any other source. So it can be participating in a walking challenge that we sponsor. They can be getting a flu shot. It can be going to the dentist, and colonoscopy, a mammogram. Once those things are all set up, then you and your spouse get a differential on the premium each month. So, and it can be up to $80 on the high end if neither spouse does it. So that's been a really good program for us, and it's growing. People are liking it more and more. You know, how has it helped? With COVID and everything, it's hard to know. We have great numbers right now. We're at about 85% to expected claims for 2020. We're on pace to do that again in 2021. So I hope what we're doing is right. I hope COVID is over. We don't suddenly see everybody going back to the doctor's office and getting, you know, procedures that they put off. But that's something that may happen.
Sounds like preventive care is a focus for you guys.
It is, and you know, I was telling you earlier with the preventive care, a lot of the doctors and physicians will do screenings for things that aren't preventive. And so then the employee who's told they have to do this, not, you know, to save money on their health premiums, comes back to you and says, you made me and my wife go, we just got bills for $279 for the labs. So we have to do a lot of patient employee education on that matter. We try to work with providers to the extent that we can. You know, sometimes they'll send the labs out to a lab that's not in network, and that can be an issue. We also did sit down last year and recreate or redo our entire plan program design, basically to allow for certain things that weren't covered. So, for example, a year or 2 ago, prostate exams annually were not covered on the federal rule of, you know, preventive care. And so people were getting their prostate exam and having to pay for it. So we changed our design to include that. Same with a lot of the other routine tests. So it doesn't cost us a lot of money to change that, but it saves a lot of goodwill on the part of the employee.
Thank you. Kate.
I am Kate Reed. I'm the Chief Human Resources Officer at American Modern in Amelia, Ohio. Sitting here with a lot of Cincinnati friends. A lot of people still know us as the Midland Company, but we go by American Modern. We're a specialty insurance company, and we are now part of Munich Re Insurance, and also part of a U.S. regional structure that is largely based from an HR operational standpoint in Princeton, New Jersey. So part of what I have to look at is how we serve our local employees. We have about 900 people who pre-COVID reported every day to our Amelia campus, and about 300 people across the field of the entire US for our claims adjusters and our sales people. And so part of what we're doing sounds very similar. A lot of focus on preventive care and wellness education. So we have a lot of communications that go out to people to help them to try to prioritize in the midst of all of their daily responsibilities and concerns about their families, how they can be proactive in their own health, and definitely emphasizing not only physical health, but mental health, because we know what a strain that is on families these days. So we have also provided some incentives for people to do screenings so they can be more informed about what they should focus on, and have provided some incentives there. We're going to be expanding our offerings in that regard soon, and those announcements will be coming out. And we are fortunate that we're part of that larger US structure, I think that we've really been able to enrich the benefits for our employees. But I think it's also really important that people feel like there's a friendly face that they are familiar with. And one of the things that we have done with TriHealth is have an on-site nurse. And that has really helped people identify more with someone that they feel comfortable with, whether it's just an illness that they're experiencing, unexpected, or something like getting a flu shot. And, just like some of us might be familiar with our family doctor, for a lot of people who may only have the time to see someone while they are at work, Valerie is her name. Valerie Bissett has been that person for a lot of our employees. And it's been really nice to see that relationship flourish with our employees over the years, depending upon the times. So while it used to be most typically, oh, I'm suddenly ill, I need to go see Valerie, more recently, she has been an integral part of our COVID planning for the whole US. So we worked with her and TriHealth to get some rapid COVID tests available for all of our locations. So that's been one of the ways that we've had a local approach.
Terrific. Susie.
Hi, I'm Susie Dick. I'm part of the HR team for Shepherd Material Science. Shepherd Chemical is headquartered here in Norwood. They're part of Shepherd Material Science. That's a global manufacturer, about 500 team members. So what we're trying to do for our team members is offer a comprehensive benefit plan that creates value for them and their family, and also keep the costs as low as we can. So we're very proud to say that we've held costs for the last 3 years. I think a large portion of that is due to plan design. We've dug into our plan and made some changes with our plan design. We also have a well-being program where wellness and preventative care is definitely a big part of that. But we go beyond just physical and mental health. We encompass financial, social, community, all of that to enhance our well-being. And then one of the biggest things I think that has helped us is our on-site nurse through TriHealth. Her name is Christy Stevens, and as you were saying, the on-site nurse can really develop a relationship with our team members. We're manufacturing, so our demographic is pretty standard. And she can listen and just really develop those relationships and be almost an extension of their primary care. So when one of the things we saw was when someone's pre-diabetic and they recommended a certain diet or something and aren't following it, they'll come, maybe they come see Christy and says, my doctor wanted me to do this, but I don't understand why. And she can take it a step further. And specifically, we had a team member where she explained why Coke is not your friend when you're pre-diabetic, and how even, he's like, well, I like Coke, I don't like diet. She's like, how about just one a day? Come tell me every day that you cut out one Coke and replaced it with the Diet Coke or water, even better. And, eventually I think she got him more on a good track and could have possibly prevented a larger, health issue down the road.
The relationship really matters.
Yeah.
So, thank you. Jack, and then Matt.
Good morning, I'm Jack Cameron with Delhi Township. I'm Township Administrator, and we're a local government on the western side of Hamilton County. We have about 90 people on our health insurance plan. The bulk of them, or half of them, are police and fire. A couple things, our main focus was retention and recruitment for our health insurance. In the local governments, it's a big part of what's a calling card is your benefit package. So that was my focus when I started 5 years ago. A few things we attacked right away, made sure we switched brokers when I started to someone who we thought fit what we wanted to accomplish and go after. We are self-insured, which is a little daunting for 90 employees. It can be a challenge. So that was a constant look at what we were doing and how our plan design was. 2 years ago, the biggest switch we made is we started with a very focused plan design. It's a Tri-Health specific plan. So we have a copay structure and it's tiered. So if you're in that first tier, you just pay a copay. And then it's very specific to Tri-Health and a few other providers. You can go to other tiers, but we tried to funnel our employees to a very specific network. 2 years ago, we're in our third year with what was Our Health and now Marathon Health, which is a clinic that our employees can go to at no cost to them. They get maintenance type drugs, acute care. You guys did a great job during COVID. So we have, I think this past year, 73% of our employees have touched a Marathon Health in some way, a little over 50% of our spouses. So in the past 2 years, we've seen a 20% decrease in our overall cost. And that's, I think, a large part having to do with employees going to that clinic model from Marathon. But so we've got a wellness program that we do. So similar to others, it's up to a 2% discount if you do your annual physical. Your covered spouse is also included in that. And then you can get up to 2% if you do all the wellness programming we have set for the year. So that seems to have driven our costs down quite a bit. Getting people to go to that clinic model early on to diagnose things before they become bigger issues has been huge. So we're seeing people like that model. The conversation about our health insurance has waned and people seem to like it. So that's a few of the things we've attacked in the last few years.
So the frequency of engagement that made a difference for you guys.
I have to think it did. I mean, we've got a 20% drop in our costs. So people going to that clinic first before they have a bigger issue start. And then the wellness things, attacking, hypertension and cholesterol, things like that have, I think, had a big impact as well.
Very interesting. Matt?
Yes, my name is Matt Michael Ajewski. I'm a senior benefits specialist for Advix. Advix is a brake manufacturer. We are located here in Cincinnati, Ohio. We also have a headquarters up in Plymouth, Michigan, which is near the auto industry. We have facilities located in Indiana and Georgia. Bulk of our folks are here in Cincinnati in South Lebanon. And we spend a lot of time, to piggyback what everyone else has said. We have a couple of things. One, we do have an on-site nurse at our Ohio facility that helps with on-job injuries. OC Health helps with that. But we've also gone, like everyone else has said, with the clinics. Each of our sites has access to a clinic. We have partnered with Marathon, like Jack said, and it's been 3 years also. So we're doing the same exact things everyone else is doing. In regards to our wellness program, we offer a pretty big financial incentive to get your annual physical. You get, and this year is going to be $1,500 for you and your spouse, so up to $3,000 off. But we're in the same boat as everyone here in an effort to not repeat myself and repeat what everyone said. Our focus has been wellness and clinics.
Great, thank you. It sounds like we have recurring themes here, and I wonder if our providers can relate to that. So people mentioned on-site nurses, they mentioned building relationship with the providers, they mentioned frequency, and everyone mentioned wellness programs. So Rob, maybe, and then Terry, if you can, tell us about your business and how do you guys work with employers?
Sure. So my name is Rob Dunham. I'm Director of Clinical Services for Tri-Health. And we have an interesting dynamic at Tri-Health because we have both the employer side as well as the healthcare side. So really on the employer side, we have focused on adjusting our benefits design to really drive folks into high-performing networks to really drive down the cost. And we do that through a couple of things. One is providing services from wellness all the way to disability. So having very focused wellness offerings as well as chronic condition management, all the way up through catastrophic management. And then on the healthcare side, one of the things we've done, as everyone has mentioned, is provide on-site nurses, provide on-site clinics to really help them drive people and navigate people to the right care at the right time at the right cost to really drive down the cost for it.
Thank you. Terry?
Yeah, I'm Terry Lehman, Dr. Terry Lehman, family doc, and corporate medical director for Marathon Health. And as you've heard earlier, we provide on-site primary care, employer-based primary care through a kind of a holistic process and a holistic application of that, focusing on wellness and chronic care as well. What we found is that, as everybody's mentioned here, is those relationships are super important. So putting your family doc actually on site, giving access to those individuals, builds that relationship, builds that trust, builds that engagement, and allows us then to refer into high performing networks, allows us to manage medications, allows us to do all those things once somebody needs care. But we actually take it a step farther. We actually kind of employ some population health tools, and we go seeking out those folks that are high cost claimants or people that will be particularly high cost claimants in the future. And we actually reach out to them and don't wait for them to come to us. We actually are reaching out to them, being very proactive. We also draw people into us through incentives, and we've helped kind of shape some of the incentives that you've heard about here so far to improve that engagement. Because what we found is it is that engagement, that trust, that really allows us to take control and ownership of a lot of those folks' healthcare, but also their wellness. And I want to differentiate that a little bit. So healthcare kind of goes back to traditional sick care. Like, I need something, I'm going to reach out to somebody and get care, right? I have hypertension, I need those things. We actually want to reach out to those individuals who are at risk of developing issues and really kind of focus on wellness. And you've heard about wellness programming and things. And wellness in our mind is that process or that journey that you go through that impacts your health. So wellness being things like behavioral things primarily, that, whether or not you're smoking, whether or not you're active, whether or not you're sleeping well, whether or not you're in a good state of mind, whether or not you're doing things to keep your mental wellness in focus, those type of things. And so we tend to focus on those things. Those will give us those returns in 3 to 5 years that you guys have referred to. But we also want to focus on those people that need acute care now or chronic condition management now. So
Very interesting. Different perspectives. Thank you for sharing these. Maybe the next step is to have a conversation about it. Do we have any questions from the audience?
One that came in, has there been an increased use of mental health benefits, and how have you addressed those? I'll start with I guess we'll start with the employer team.
I don't know that we've seen much of an increase in the use of mental health services, but we do have an employee assistance plan, and we've consistently pushed out communications about that. And I do know personally of some people who have used it. I don't have any data yet as to how much it was used, quantifying that, but we really started promoting that probably at the beginning of this year. Last year, of course, when COVID started, nobody knew what we were doing. We were just making it up as we went along. And so, the one thing for us is that most of our locations stayed at work. Our crane operators don't get to climb cranes on a sofa in their pajamas. So we made a cultural decision to not make it look like that we admin people were able to do that while they were out in all kinds of weather doing what they did. So that was a cultural decision we made. And I'm glad we did it because I did participate a lot with some of the portfolio companies that follow local management, those that owns us, all went home and they were contacting me about mental health and coming back. And I saw that they were having to use a lot of mental health resources. Whereas I'm hopeful that we did not need such a degree of those resources because we allowed people to bring their kids to work. We allowed a lot of things that would otherwise have caused a lot of those issues. So
Interesting. Do you guys see any difference?
We have through our EAP usage increase. We only, obviously see the high level numbers, but for individual counseling, family counseling, and then also our visits to Christy, our nurse, increased. And some of those were COVID related, maybe not personally for the team member, but for their family or a parent who's dealing with COVID or who's in a nursing home and they can't see them. So, it was kind of just a sounding board for our team members, someone to listen to, or why can't I go see, mom or dad or grandma in the nursing home, and Christy being able to listen and then explain to them. And then also from a manufacturing standpoint, we didn't close, we all had to show up, like you were saying, can't make chemicals from home. And so we tried to have our response to the situation, especially back in March 2020, with our team members in mind. How can we reduce the stress on them? And one of the things we did, one of our commitments was to keep a full workforce, which that was a challenge, but obviously, looking back, I think that really did a lot with their mental health, right? They don't have to worry about a layoff or something. And we had to get creative to do that, but
That's a kind of interesting contrast between, remote working and manufacturing. Do you guys want to relate to that? You have more people working in offices.
Yeah, our police and fire didn't work from home, I can tell you. We didn't see anything from our employee base, but we do have social workers, one that works with our fire department and one that's coming on with our police department. But that's not related to our employee base. That's general public kind of thing. So I would say we see a little bit more of that than we did, with our runs, but not as it relates to our employee base.
Yeah, so we have most of our workforce has been working from home, so it has presented some challenges in just making sure we understand their needs. So we've also been publicizing more about our employee assistance program, and I think it's been a nice sort of reimagining what that benefit is all about, because I think often in HR it was sort of referred to at just the really difficult employee related moments instead of, hey, this is a benefit that you need to be thinking about, just like you think of your family doctor. And I've noticed, just anecdotally, people feeling more comfortable saying that they were taking advantage of that. So that's been really refreshing. I think in HR, we've also tried to just stay more connected with our employees and their needs in careful ways by just helping them understand they can express to us what they're looking for. And through those conversations, I was able to get a better understanding of some of the unique needs coming up these days around mental health concerns. One example being people feeling really frustrated because they were having difficulties finding therapists that their teenagers were comfortable talking to. And so I made sure that our head of diversity and inclusion was aware of this, because some of those concerns related specifically to, what they felt comfortable expressing to a therapist. So even just trying to get an understanding of how do we make sure that our benefits pay attention to issues like teenagers who are only comfortable talking to a therapist who understands LGBTQ issues, and how do we start looking ahead how we can have more inclusive benefits, and those are conversations that I think we didn't have just a couple of years ago, and I'm very careful about how I have those conversations and what I will not share, but I think it's really important in HR that we get a deeper understanding of the wellness needs.
Interesting perspective, Matt. And then I would like to hear from our providers here about how they're deploying or how they're treating it differently.
Yeah, so we obviously, like everyone else at EAP, I think the one thing that has sort of happened, we had a shortage for mental health prior to anything happening with the pandemic, and now this has sort of been exposed. We've been working with our clinics to make sure that we're trying to help folks that are coming in. They're talking to them. We've tried to increase our communication, just like everyone here. We're running manufacturing. I don't know if you knew this, we're buying a bunch of cars. So still need brakes, and we're still producing those. So, staff has been there. So, just trying to help up our communication, make sure people are doing well. And again, working with our clinics to make sure that they're taking care of our folks.
Yeah, and I think for TriHealth, again, the double-headed approach with treating our own team members. So we provide EAP services, and we've seen a significant uptick over the past 2 years with our EAP services, not only for our employees, but for the employers that we serve. So TriHealth deploys EAP services to several different companies throughout this region and across the nation. And again, we've seen that increase. The other ways that we've supported employers through this transition is we've provided toolkits to our employers throughout this on everything from stress management to really how to deal with the trauma that is associated with COVID, and how to do that as an employer, as well as how to do that as an employee and family member.
Those are really helpful.
Thank you. Excellent. We've got a lot of good feedback on this. We provided presentations for free to our employers as well with our medical director and our director of EAP services. A lot of good feedback on that, a lot of good information has come from that. And then from a population health perspective, TriHealth has really worked with our providers to treat the person holistically and really take that population health approach for managing the entire person and helping them navigate to the correct resources that they need. And a lot of times that is mental health services or psychiatric services, and really treating that entire person and not just the problem.
Great, Derek.
Yeah, so at Marathon, we recognize that behavioral health and mental health issues cloud a lot of things and make it very difficult for us to get some of the outcomes that Jack and Matt have talked about earlier. So a number of years ago, we actually started deploying behavioral health specialists into our health centers for aligning with the EAP programs of our employers if they so choose. And so bringing those folks on board to help sort through some of the behavioral health issues that were blocking somebody from getting success in diabetes management or in empowering them to get out and be more motivated to exercise or do those things. So before the pandemic even started, we were deploying those things on site in our health centers. And I don't know if you guys have one of our behavioral health specialists on site or not, but not currently, but we'll talk after this. And then during the pandemic, we recognized there was going to be a huge upswing in behavioral health needs, or we anticipated that. We actually had our health centers on site, and I assume Matt and Jack participated in this as well, reaching out to a lot of our folks that were thought to be perhaps at risk of social isolation. So we made somewhere in the ballpark of 250,000 outbound phone calls to our members to outreach to them, just to let them know what's going on with the pandemic, to hear them, to listen to them, answer any questions they had, make sure they had their refills during the lockdowns, et cetera, et cetera. And now rolling hopefully out of the pandemic here soon, as we're talking to more and more employers, we've actually doubled the number of behavioral health specialists that we're putting on site right now. So most of our, I don't know if I can say most, many of our new customers are actually putting one of our behavioral health people on site. So it's become a huge issue. Those folks are getting very busy very quickly, and we recognize that that's just going to be an issue for a while afterwards. There's going to be almost a PTSD kind of tail onto this thing. So I just want to applaud you guys for addressing some of those social determinants of health that go along with this, like keeping people on payroll, that financial insecurity, like that contributes to health outcomes, that contributes to their mental health issues and everything. So that was a huge step I think you guys took. So hats off to you guys.
Really great question. Thanks, everyone. Do we have any more?
We do have a question from the chat from Jim Papp. Jim says, I'm interested to hear how employers are looking at differential outcomes across the provider network as a means to make decisions around an optimal network that can demonstrate outcomes, e.g. decreased hemoglobin A1Cs for diabetics.
Anybody wants to take that? Compounded question.
I'm going to translate.
How do you look at data? So,
Yeah, I think for us, what we're really trying to do focus-wise is one, work with our broker to understand our data. But I think really where it comes down to is working with our clinics that are seeing these folks more often than not. And then developing, like Dr. Lehman has said, developing that relationship. We've always said when we looked at clinics, it didn't matter what name you put on it. It was the person that was running the clinic. And when they develop a relationship and get an understanding of that, that's helpful. But I also think that two-piece part comes into having our folks that are part of the wellness and getting their annual physical, and they go to the clinic, that they're getting followed up on. So, hey, here's your A1C. This is what we need to do. Instead of, here's your results, call us if you have any questions. And I think that's the part that the next step we've sort of taken in our wellness program is, one, developing that relationship, but two, action on those results. I mean, prior we had someone come on site. It was awesome. We had a lot of people take care of it. And then what was happening was you get your results, you put them in the drawer, and you move on. No follow-up. So I think the key is developing the relationships and then having those folks follow up. And that's where I think you start driving some of those results.
We get, so I have meetings with my brokers monthly. We go over the numbers and what the conditions are that are treated for, what's being treated for the most, for the high risk issues. And while they've gone to their family doctors, most of them, like by this point in time, there's still follow-up that needs to be done. And so WellWorks does on our behalf. Obviously we can't because of HIPAA issues, but WellWorks actually does reach out and maintain close contact with these people to make sure they're not falling off of the plan that the doctors put them on. So
Data is playing a greater and greater role in how we understand health and health needs. I know we teach it in class, but I don't know that, it's ubiquitous. Anyone else wants to address?
I'll just add from a healthcare provider perspective, it's all about transparency and really being transparent with our employers on what the data shows. TriHealth is on this population health journey for the past several years that, now 75% of our revenue comes from ambulatory care versus inpatient care, which really helps to drive costs and drive the costs down. Case in point, I think diabetics were brought up. We do a lot of experimentation, not wrong, a lot of work and trials on our own employees through our health plan. And with diabetics, we've seen by embedding CDEs, health coaches, and condition managers into the practices and really bring them along with the practice and the providers, we've seen a two-point reduction in our A1Cs in our diabetic populations that are engaged with those healthcare providers. So I think it's all about transparency. And then the other thing for choosing a healthcare provider is really a provider that is going to put the money where the mouth is, in the sense that we have aligned our physician compensation to really impact our outcomes and our costs by our physicians are paid by making the right choices for the right outcomes at the right cost versus the traditional fee for service. And then lastly, transparency in our physicians. So our physicians know each other's data and they can see their peers and really understand, okay, my costs are higher and here's why. I really need to talk to Dr. Smith, who's really showing great outcomes, and how do I improve my own outcomes? So I think it comes down to transparency.
Rob, we work with your team, with the TriHealth team, developing our wellness program with, we started with know your numbers and then completing physical and biometrics, and then took it a step farther that, depending on your biometrics, if it's determined you have metabolic syndrome, we have the Real Appeal program, we have health coaches, and then upon completing that is when team members are eligible for their wellness credit. So it's like you were saying, doing a little bit more than hear your numbers and put them in drawer. So that's been really beneficial.
Well, I think that's the great thing with the wellness programs that are out there, because you can get your feet wet and really just give people credit for doing things, but then you can take it to where you are and really driving outcomes through your wellness program.
And that's how we started.
Yeah.
You got credit for going to the dentist and just all, and then it's like, yeah, that's not where we want to be, and move forward from there. But,
Absolutely.
Larry, did you have
Sure.
something to?
No, I think everybody's made the right points here. Is we want to incentivize both the member or the patient as well as the team to do the right thing to drive those outcomes. So most of those outcomes are driven by behaviors. So incentivizing healthy behaviors usually leads to good outcomes. I would challenge that even going one step further beyond the A1C and the cost reduction and life longevity. If you're driving that A1C down with insulin or with some other high cost medications and not addressing the behavioral side of things, may be a short-term win, but a long-term loss. So we try to really focus on those behavioral changes, and we employ things like motivational interviewing and appreciative inquiry. We have health coaches, and all of our folks are trained in health coaching techniques, and we have health coaches embedded into most of our clinics to help drive those things. And then we give the monthly reporting back to everybody. So like, here's what we do, and here's how we perform this time, and both from a cost revenue savings as well as from an A1C and a blood pressure and those type of things. And so I think transparency is key.
Perfect. More questions?
Another question. So we spent a lot of time talking about improving the health status of the populations, of your employees and dependents. That really focuses on quality aspect. So another aspect that drives cost is the unit cost. How much are you paying across your network? There's a lot of innovative, or some may say fringe models, whether it's reference-based pricing or models like that. Have any of you explored those types of models, and what are your thoughts on how that might reduce costs or impact your employees' health negatively or positively?
Not at Maxim Crane Works, because of just the fact that we're located throughout the country. But my prior job as general counsel for Riverfront Steel, which is now, it's been sold to something else, but we had just under 100 employees. And when I joined there, we were fully insured, and we went to self-funded, and then we tried true cost. And it sounded like a great idea, and it may have been helpful to some, but from an administrative standpoint, I found it very difficult. I thought it was very difficult to manage employees' expectations about balanced billing or what doctor they were going to. There were certain hospital systems in town that refused to negotiate, so we had to play games with the lawyers and try to get that money adjusted however it was. So while ultimately we may have saved some money, I think we created a lot of hostility and I don't know, bad will, if you will, with a lot of the employees that worked there. It was a steel processing center, so a lot of our guys were out in the shop. They were not union. All they saw was the bill they got or the denial payment, and then they come to me, and instead of contacting the insurance company. And I think maybe over a few years it might have gotten better, but I would say from a cost standpoint, yeah, it works. From a goodwill and an administrative aspect piece of it, I'm skeptical.
Yeah, and to piggyback off of what you said, we are very fortunate here in Cincinnati. We have access to great hospitals. We have a lot of different avenues to, let's just say, a knee surgery or a shoulder surgery. We have access to that, and we've actually been approached to kind of go into that model. And what I would say, where I've been hesitant, where our committee has sort of been hesitant, is forcing people to go to a certain place. Even though it's a discount and we think everything's going to go well, it takes one bad experience, and that's where we are hesitant towards going. Do I think it works? Absolutely. I think that, again, it works here in Cincinnati because of all of the access that we have. Doesn't work necessarily in our other states that we're located. Great model, just doesn't work for us right now. But the intent is definitely there.
Anyone else wants to?
Yeah, I would say, unlike Matt, we weren't hesitant.
Right.
And we did explore where our employees were going, and 75% of the use was TriHealth. So they brought online a program that was focused towards the TriHealth network, and we did that and had to make sure people understood how it worked. And if you weren't at a TriHealth doc, you were going to have to transition, or you had the tier 2 model, which was 80/20. So we deployed that, and then we felt like it was pressing the easy button. Here's where you go. And then we incorporated the marathon clinics. And so we thought that helped employees feel good about the benefit. That was one of our targets. And we've actually seen the cost go down 20%. Now, whether it's all that or all marathon, I think it's a blend of both, and people getting used to it, getting the treatment they needed because they could, and it was easy to do. So it's worked for us, that particular structure.
I mean, I'll add from the TriHealth perspective, really having that high performing network, as you mentioned, but also giving choice. So, we also partner with independents, so it's not just our providers. There is choice there for your members and the team members. So I think that definitely helps with the perception and people getting performing up.
Well, I would agree. I'm actually not as close to the plan design conversations as I used to be. I'm further into the HR perspective of let's make the employee experience as easy as possible, because all of the points we were emphasizing earlier about preventive care, anything we do that makes it in any way a less than positive or easy experience takes them away from being willing to go ahead and make that visit before it's an emergency. So that's usually the perspective I'm trying to offer as we're looking at what direction we
Terrific. Any other questions?
I'd like to jump off of Kate's last point there on employee experience, especially this labor market, looking to make the benefits accessible and easy to understand and a joy to use versus hindrance or pain that some of the RVP models you're talking about. I'd like to hear what the group is doing on that front, considering the labor market right now.
Yeah, I mean, I'll just say, I mentioned earlier, we haven't fully announced it yet, but a new, more digital wellness offering that's broader, like you mentioned earlier, that it's not just about physical wellness, but all aspects of well-being, including financial, and offering more incentives to make that a part of your life is one thing that we're looking at, in addition to just the more traditional aspects of make it really easy to go to the doctor and providing that.
I would like to hear from our providers about technological solutions, to primary care or to remote care that improve outcomes and improve experience.
I'll piggyback off of her comment just for a second, and then I'll pivot to the technology side of things, if that's okay. So what we found is that by embedding a health center on site and giving that as free or low cost access really improves recruiting for a lot of our folks. Also improves retention, which is huge. And I don't know how much you guys spend on retention of employees and trying to make them satisfied. It tends to be a huge employee satisfier is what we've been finding for our employers. And then those employers are more willing to invest longer term dollars because they're going to keep those folks on longer. And then that just improves health incrementally over time instead of like fixing the here and now. And then knowing that 50% of your workforce is going to be replaced in 1 or 2 years. So I think that employee retention helps a lot. And that the model seems to really drive that. So, and then pivoting to technology, the pandemic taught us we could do so much, right? So we were mostly, I would say 95% of our visits were face-to-face on-site visits. We did have some remote visits going on. Pre-pandemic, everybody had been exploring a lot of virtual care, a lot of remote care. And then the pandemic hit and we pivoted. I'm proud to say in less than a week, we pivoted to 90+% virtual visits fairly seamlessly. So, and currently we're somewhere in the middle of probably a 70-30 mix right now, I would say. I don't think virtual care is going to go away because a lot of folks have like you guys, and except for maybe the Crane folks, and the laborers and things like that, the police force, they found that they can work from home a lot of times. And so they don't need to be concentrated in one location near a health center, near a physical health center. And so they've been moving farther and farther out into the suburbs or surrounding area or relocating to Florida. And so what we think is going to happen is there's going to be a large percentage of folks that are going to continue to work from home. There's still going to be your responsibility and therefore our responsibility as well to drive those costs down. So we pivoted to a product called Anywhere, which is our virtual care platform where we're doing not just transactional care where it's like, I have a need, I'm going to reach out to this point, an online doc and get something taken care of. But it's again, building that relationship and that trust over time. So it's a primary care model for virtual care. And we're employing a lot of remote patient monitoring devices as well. So blood pressure monitors, Bluetooth enabled glucometers, scales, all those type of things. And so we've pivoted to doing this. And we think it's going to be here for at least the foreseeable future.
So one of the benefits of that is, if someone's monitoring their glucose or blood pressure, then they're taking ownership of that, right?
Mhm.
I mean, so.
Great
it's a
point.
hidden
Absolutely.
benefit, yeah.
Very empowering
Yeah.
to the patient, to the, we call them the member, to the members, for them to actually get access to those type of tools that they would have otherwise had to pay, or they go pay for, gone out, sought out on their own and downloaded apps. We actually provide that, and then there's coaching on the back end of that. So for outliers and things like that, we can reach out to those individuals directly.
And the virtual visits also extended into the mental health field.
Absolutely, 100%, absolutely.
What a great conversation. We have about 5 minutes left. And I would like to open it up to a conversation about, I don't know if I call it wishful thinking, but if I could, this is what I would like for my employers, and, and the providers maybe can respond about, how they adjust and change their, business model to accommodate this need for retaining, hiring. We know we're in the middle of a flux, employee flux. People, heard that term. So, if anybody wants to jump in, what would they want to see in benefits, and the providers maybe can respond to how they're thinking about adjusting to this new reality.
So last year, we were with Highmark Blue Cross Blue Shield. They entered into a contract dispute with the Penn State healthcare providers. And the other headquarters is here, but there's an administrative office with a lot of employees. And then we also have a large branch of Pennsylvania. And that was a real problem. Right now, UHC has the same thing going on with a hospital group in Georgia. So these are the things that I see that I wish we didn't have to have midstream contract. We've already negotiated, between the healthcare provider and the insurance company. And that's where you get the employees calling when their doctor is no longer on the list. And, this particular group affects maybe 6 people, but those are 6 really important people and their families. And the communication between the insurance company and the record keeper, I should say, and the hospital system, they're sending warning communications out to the employees and expecting me to fix it. I'd like to know what your thoughts are. I mean, this group was looking for like a 40-something% increase in the middle of a 2-year contract. And I don't know where that kind of thing comes from, but thoughts? Because it affects our employees. And when you talk about retention, I mean, these are people who are going to potentially go somewhere else because they can, and somebody who has coverage for them, that helps hospital system.
Yeah, I think part of that's out of your control because
It
it's the provider that does that. I think it's funny you asked wishful thinking. We actually had a conversation with Marathon, and their list your ideas. I had a laundry list of things that I was excited about, but I would say the 2 things that probably stick out to me the most are, one, predictability. So we sort of have our hands tied as employers, knowing individuals and that go in for certain diseases. So, for instance, if Tom goes in and he has high blood pressure and he needs to take medication, we don't know. We can't hold them accountable. So it's our provider that is holding them accountable. I wish there was a way to know, and I know that there are ways to find things out, and hold them to their ability to take care of themselves. At the end of the day, we all sit in this room, we talk about money. I think we can all speak about, we just want healthy people. I mean, we want people to be healthy when they come back to, they come to work, they're happy, they're healthy. We want to take care of them. And yeah, it comes down to dollars. I get that. But at the end of the day, we want our team members to be healthy. I think the second part is working with our clinics and having someone on site that could address those types of things. Getting in front of people and going to them. What we have found in manufacturing is people don't want to take the time to go do the things themselves. So bringing it to them. And so working on those types of things to address. That's my wishful thinking. So more predictability and more in your face in front of you.
Great. 2 minutes. If you guys want to relate to that.
I think to your point there, there's a couple things that we as healthcare providers can do. One is just really looking at the integration all the way across and making sure that we truly have clinical integration to help drive that predictability.
Right.
Also risk-based contracts. So, you're at risk, we're at risk, and our goal is to really meet those goals. So, and if we don't, then we lose and put our money where our mouth is. And then lastly, as I mentioned before, just designing our provider compensation around meeting those goals and meeting the company's goals. And I think overall, it's a conversation. It starts in a room like this, but then it's an individual conversation with the healthcare provider and the company to really partner together to understand what the goals are and then design plans, design programs to really meet those goals.
Great. Sorry.
Yeah, just real quick, I'll just, to Peggy's comment about frustration over dealing with networks and contracts and everything. And I'm happy to say we're agnostic when it comes to those kind of contracts and everything. So we sit in front of the health plan and try to take all of the expense and all the visits and everything that we can and consume those things and make sure that we turn those into good outcomes. So you're not faced with dealing with that 40% surcharge on that contract that you thought you had worked out and everything. That's a topic of predictability. That's not something that you plan for or budgeted for. And then, we're, I guess, as Matt was saying, we're on site and we take all those things. So for that predictability, it's a per member per month fee, and we do put our fees at risk. We do have performance guarantees that we put out there, fairly hefty ones, that if we don't achieve certain metrics, that you don't have to pay for those things. So there's certain performance guarantees that we have out there that we do put our money at risk. So
Terrific. What a great conversation. Thank you so much. Thanks for the panelists. Thank you for Eric Newville, who is behind the camera. Thanks to Josh Martin for fielding questions. Thanks for our assistant, Nancy Sampson, who will arrange this. Thanks for being here. Thanks for coming. Thanks for sharing your thoughts.